Guys,
Yo!
what's up?
We got it working.
The
All
day
right.
has finally come. The day has finally come. Hey, Jesse. Hey, Kaya. How you guys doing? Good to see you all. Thanks for coming on early.
Hey, stop.
Wait, can you guys hear me?
Yes.
Okay, cool. Yeah, I was just.
Did you want to do the selfie thing or what?
Yes, let's do it.
So how do you want us to do?
Let me see. Well, I'm just reaching my hand over to my phone so we can just take a screenshot, I guess.
Okay, you take the screenshot.
Yeah, I'll do it. I'll do it. Okay, 1, 2, 3.
Frozen.
Saved it.
Alright, done.
Yeah, because
We'll
I
do
did
one
a
on the side
screenshot,
as well.
so yeah, let's do it.
Alright, 1, 2, 3. Okay, technology, right? Technology.
Come on, technology.
You are dressed so well.
Oh no, I just ironed out a nice shirt from Uniqlo. That's about it.
Hey, it's called House of Uniqlo.
Is it really?
No, just kidding. Because it's always like Gila and all that kind of stuff, so we just call it House.
Right. Oh, you guys are all in your scrubs except Keith, but
Yeah.
I love scrubs. I mean, that's what I wear in my clinic too.
So that's so convenient.
Yeah, it's stretchable too. It's durable. It's breathable, especially in Singapore and KL. You know.
Yeah.
Yeah. Okay, how are we going for time? Oh, good. We are good for time.
Yeah.
Good. We've got 3 minutes to 12.
Hey.
Okay. Well, I just gonna get people to come on. So all these people that are on, I think some of them are actually from KL, right?
Yeah.
I think so.
Some of them are our fans. Some of them are family members. Hi.
Come on.
To everyone's mom and dad out there.
Hey.
But it's good to see the support. It's good to see the support.
Yeah, that's great.
Let me post
You
that.
guys are paving the way. That's awesome. I'm trying to make sure I wave to everybody here. India, Thai. Okay, very cool. Wait, have you guys had lunch yet?
After this, it will be good.
After this? Okay. Well, Chandra, you got a patient at 1 o'clock, right?
1:15.
Oh, 1:15.
Yeah.
Okay, got it. Yeah, I guess what we can do is like whoever whoever wants to speak, I guess we can just get them to I guess move forward so that it doesn't get too muffled. What do you guys think? Yeah.
Can you guys hear clear? Like, is it clearer when I'm nearer?
Yeah, actually, yeah, it really is.
Okay.
I think we can use the mic thing.
Yeah. Okay.
Okay. Hey, if you guys are already on this IG live, if you guys have any questions for either myself or Keith, Dr. Chandra, or Hannah, just put it in the questions chat, and then we'll get to it in the last 15 minutes or so, so that we can answer every one of your questions. Sorry, what?
Cute. Your mom says hi.
Hi, Mom.
Oh, is that your mom?
Yeah, that's my mom, the one that said hi, CM and all.
Really?
Hi, Auntie.
Wow.
I think he needs a shave, right?
No need.
Oh, Jonathan, how are you doing, sir? Yasin, good to see you.
Hi, Steffi.
Pulling up the questions here.
Almost done with it.
Okay, are we 1 minute out? Very cool. Awesome.
If you want to talk, you have to.
Hey, is Keith gonna be here? Is Keith here?
I'm here.
Oh, okay.
I'm here. I'm just replying messages from, from our general line. So
Right.
Hi, Jessie.
Jesse.
Sophia, how are you doing, Sophia? Sophia, she's a clinical psychologist or psychotherapist at Core Collective. She is amazing. Caught up over lunch just the other day. Sophia, you are a legend. Thank you. for all you
Hi,
do,
Mike.
humanity.
Can't see who's joined. Maybe we should put this on the iPad.
Auntie Nancy. Okay, guys, it's 12 o'clock.
Right. Cool.
Let's get started.
Yeah.
All right, how you guys doing? Welcome to this IG Live special edition, episode 2, Heart of Collaboration with Spinefit Chiro Physio, all the way from KL in Malaysia. We have Hannah Chong on the extreme right of your screen. That's our beloved physiotherapist. And then we have a chiropractor in the middle, Dr. Chandra. And then we have the business manager, the guy behind the scenes, the guy who actually started this whole thing. He's the one that reached out to me, and we just started connecting in that way. But Keith, you're the man, you're the legend. Thanks for coming on and helping out and initiating this whole thing. Much appreciation to you. Okay, so today, guys, we are really going to talk about the heart of collaboration. You know, a lot of us, we sometimes wonder if within the profession there can be collaboration, within inter-profession there can be collaboration, and that's something that you are actually all looking at right now. At the bottom of your screen, there's 3 of them, right? Plus one other chiro and 2 other rehab specialists. You're looking at a collaborative, focused clinic, and we are going to learn from them today. So I'm really, really excited. Personally, I'm just so pumped up to learn how to collaborate from these champions. I'm just a young doctor in the field of only a year and a half, but I am so blessed and just graced to be able to learn from these guys. So let's get started, shall we? Right. And again, for those of you guys who just joined, if you guys have any questions, please put in the question chat, and we'll definitely get to it by the end of the session. Okay, we'll have our last 15 minutes of the session for Q&A. So be sure to pop in your question there, and we can go from there. Okay.
Yeah.
Alrighty. Okay, so I just wanted to quickly talk a little bit about collaboration versus competition. That's something that has been on my heart for a long time, and really, what does it really mean to have collaboration? Like, how can we put aside our differences? How can we go like, hey, I have this set of skills, but you have this other set of skills, and how can we actually tap on each other's potential and for the benefit of the patient? So one thing that I personally noticed in my 10-year tenure of trying to become a surgeon and going to medical school and all that stuff is that competition is what drives rivalry, right? Competition is what makes everyone go like, hey, I'm the best, you suck. I'm not going to touch your turf, and you're not touching my turf. But what happens when we actually collaborate? So that's something that we really want to dive into today. And I kind of wanted to briefly touch on the 3 forms of collaboration. Right, there's actually intra-professional collaboration, there's inter-professional collaboration, and lastly, there's actually collaboration with you as a patient. So all y'all listening, you guys are actually patients that we want to collaborate with. So let me just touch a little bit on that. I remember there was this mentor that told me, he said, no patient will ever care about how much you know until they know how much you care. And I felt that so important, and just looking at the way Spinefit Chiro do their things, like I can imagine that every person actually trusts you guys because they know that you care for them, because you're not just concerned about like promoting your own arsenal of skills, but you're actually saying, hey, you're humble enough to go like, hey, I need help in this area, like can we join for it? So that's a collaborative aspect for you. You guys are the patient, and that actually resonates with the vision of Chirogenesis, to honor you and your generations, to equip you with quality health. Like that you are the focus. Like the patient is the central focus of this entire practice. And interprofessional, I can get into the whole history, but I think if you guys want to catch up on the history of chiropractic that I got into the first session of Chirogenesis, you can go to my IGTV, What is Chiropractic? It's a document I did about a month ago. I briefly talked about how competition is just completely riddled. I mean, this whole profession in chiropractic is completely riddled with chiropractic. We're just talking with Dr. Chandra the other day, and both of us practice different techniques, and yet there are rivalries. But we are promoting the same art, promoting the same, profession and the skill of chiropractic. But yet there are so much differences that drive us apart, and that honestly doesn't look good in the profession. So how can we collaborate interprofessionally, right? And intraprofessionally, oh sorry, that's intraprofessional. So intraprofessional is exactly what you're looking at right now: physiotherapy, chiropractic, and yeah, like just like how I was catching up with some of the counselors and the psychotherapists at my workplace. This is all something that we are, you know, but just wanted to break down the different types of collaboration for you guys. Interprofessional, which is what we're doing here. Intra, which is within the profession itself. And finally, collaboration with you as the patient. Okay, so I kind of wanted to put out this question to Dr. Chandra, right? First up. So can you tell us, sir, why even collaborate? You know, why even collaborate? Why not just do your own thing as a chiropractor? I mean, because honestly, coming from a chiropractor myself, I think I'm pretty good, like where I am, you know. But what gives you that humility to go like, hey, I need help from Hannah. I need help from other rehab specialists. Come speaking to that, and the floor is yours.
Okay. All right. Firstly, can you hear me?
Yes.
Okay. So,
very clear.
Firstly, all right, my girlfriend's a physio. So if I don't collaborate with her, I'm dead, right? No, but all seriousness though, to me, look, the way I've been trained, the way that I learned in uni, we were taught some part of rehab. Okay, so technically, if I wanted to just be like, okay, I'm good enough, I can give my patients exercises, I could have done it. But for me, I always feel that if there is someone who knows better, is specialized in a certain area better than you, you should want to work with them. You know, because at the end of the day, it's all about growing, it's all about learning, you know.
Yeah.
And at the end of the day, whatever said and done, it's all about the patient, you know. I know, you know, like with restaurants and stuff, when you go to a restaurant, they say the customer's always right. Okay. There's a bit of a gray area with that, okay, when it comes to us, but at the same time, we do everything for the patient, okay?
Yeah.
And that's something that I think that when I switched, I was at a mindset where it was like, nah, I'm just going to tell the patients that, look, this is what I need from you, this is what you need to do if you want to get better, etc., etc. And it wasn't really resonating with them. But I think when you start putting the patients first and you're like, okay, look, you've got these issues, but you're not that strong in certain areas. Okay, I need to go and talk. I need you to go and see the physio and stuff like that. Then when you put the patient first and you know that they need a physio, they know that maybe they need dry needling, maybe they need, you know, maybe they need counseling, something like that. When you work along with other professions, you just get the best for the patient. So so that's where I sort of went towards, you know. I think it's easier to always just stick to what you know. You know, it would have been always easier just to be like, okay, I'm a chiro, I'm just going to crack you and do a bit of massage and okay, you'll get better as you go along. But I think this is the better way to do things. Yeah.
Right. So has there been any moment where you and your girlfriend went like, you know what, I actually don't agree with you, and how did you overcome that? Was there any instances where you went like, you know what, babe, you're wrong, like, and then it's like, no, you swallow your pride, and then you guys come to a middle ground and you guys work things out. Like,
this is constantly.
We're talking about work, not your personal life.
No, I'm talking about work as well, constantly, right? I mean, there's been heaps of times, you know, but I think it's just about finding that middle ground, I guess. You know, I think like the way that we both been taught, especially like her, like I've noticed a few times, she's told me that in uni, like sometimes her lecturers will say, oh, don't work with chiros, things like that. But I think she's quite open. We fight a lot about, you know, different, like when I talk to her about a patient that I'm not too sure about, she will tell me you should do this, but then I'll be like, no, and then we'll fight. But then at the end of the day, we find the common ground, and then we're like, okay, this is how, you know, it's gotten better. It was really bad at the start, but now it's going to be better.
Okay, very cool, very cool.
Yes.
Like, has there been any form of like collaboration where you took things to the office and go like, hey, I guess we need to try this out because my physiotherapist girlfriend said this, and then it worked. Was there any example like that?
I guess I do that pretty much every day with these guys. You know, like I talk to her at home, like, and then when I come out, I sort of discuss with Hannah or the other physio, and we just sort of work things out, and I give them my opinion and what she's told me. So so it's
it seems like you're like circled around, like you're surrounded by just like you're kind of almost like forced into this collaborative
Yeah.
Everyone around you is like, yo, come on, man. Like,
Yeah.
that's
It
so,
is, it
that's
is, it
really,
is.
really cool.
It
Wow.
is, yeah.
Well, thanks for speaking to that. By the way, for all those you guys who just joined, if you guys have any questions, you guys can always put it in the question chat, and we will love to answer them either by myself or any of the three of them from Spinefit Chiro Physio. So if you guys are actually wondering who these guys are, they are amazing collaborative focused clinic in Kuala Lumpur in Malaysia. So be sure to pop in your questions if you guys have it. Okay, let's pass the time on to Hannah.
Yeah, no worries, you can see.
Shall we do that?
I just cut off.
So yeah, we just want to hear from all three of you regarding this first question. So we'll go with Hannah now. Like, yeah, same question. So why even collaborate? Why not just do your own thing as a physio? Like, can you speak?
Yeah, I think Chandra has touched on it already. It's like it's really about the patient. When any clinician, which is like either a physio or a chiro or even a doctor, they think that they can go about it on their own. I mean, they're not wrong. They might be able to, but what is the end goal, right? We never forget that it's the patient that's coming to you looking for help for their pain or for their dysfunction, that they want to get better. So it takes the focus off from us onto the patient.
Yeah.
That really puts things into perspective, because maybe as a physio, I could see a patient and I could get them from 0 to 100 within maybe 5 weeks. But if I could work together with Chandra, or I could work together with a chiropractor and get them from 0 to 100 in 2.5 weeks, wouldn't that be better? Yeah, it's not. Yeah. Is that real? So I came from a background. Okay, my boyfriend's a physio as well. We studied in Physio University. Oh, fiance, sorry if you're watching, I forgot. but like all throughout uni, right, we've always been taught by the lecturers that, oh, don't work with chiros, all they do is crack, and then you need to come back every week for the rest of your life, and they scam money. And I was like, oh really? Oh, okay. Then my first job out of uni, Keith actually contacted me, and I think someone passed my resume to him, and he was like, would you like to work in a chiro clinic? I was like, oh, well, I guess I could try. No one else is hiring, sorry, Keith. But I came with an open mind, and I realized, like, okay, wow, it's not about chiro, it's not about physio, it's really about the patient. And I said yes to the job, and I've not regretted it. Like, I've seen how it's really helped people.
Yeah, so how long has it been since you joined Spinefit Chiro Physio?
In what sense?
As in, how long have you been in this company for?
How long?
How long? Yeah.
I think this is coming to the 3rd year.
Wow. Okay. Right. But what about you, Dr. Chandra? Like, have you been in this office for a long time?
So I joined last year in January.
Oh,
so
last
it's
year.
It's been a year. Yeah.
Pre-COVID.
Yeah, pre-COVID.
Right.
Yeah.
And Spinefit
He was
Chiro
previously
Physio
working
has been
in
around
Perth.
Sorry?
Oh yeah, that's right. Reaching Perth.
Yeah.
No, but just for the sake of the audience, like, how long has Spinefit Chiro Physio been operating for?
Yes, Keith.
We've been around end of 2015.
14.
Yeah, we've been doing this. We've been doing for nearly about 6 years. So yeah, we've been around.
Yeah. Actually, this is the perfect segue. I think we pass the time on to Keith, the man with the vision. Tell us a little bit about what actually made you start this clinic.
Yeah, so I think just to give a bit of background and context,
Please.
So my partner, who is actually Dr. Aaron, he's currently based in Melbourne at the moment, and he's, both of us, we came together to start this place up together, having been flatmates in New Zealand ages ago, and being probably his patient zero when he was trying out his techniques when he was training over there. So I've been well aware with what chiro is from a very long time, way before when I came back to Malaysia as well.
Yeah.
I think when I came back in Malaysia in 2009, it was still generally, it's not the scene, if you would say, in Malaysia, it's not as vibrant as it is right now in terms of the number of chiropractic practices that are coming up. But what's great to see was, the ideas that we came, and the reason we came together to collaborate on this. I'm not medically trained, My background is in marketing, advertising, and business operations. So that's where I brought my expertise in that. So Dr. Aaron, with his expertise in terms of him being the practitioner, the chiro, we said, this would be a fantastic thing that we could do. Although he came from a background where there was an integrative practice that was already taking place where he was working, but because of our experience in New Zealand, and I'm sure that if some of the audience here have been either to Australia, New Zealand, or UK or America, where going to someone for an injury related to sports, you don't go and see a GP. You go to see a physio. You go and see either a chiro or you see a whoever. You don't go straight to a GP. But over here, what we realize, and we still see it to this day, where people will come in and they are so lost and they're like, I had this injury, I don't know whether it's a place I should come to.
Right.
And on that note, on collaboration, so over the years that we've been here, 4 or 5 years of being here in KL, and the place that we're in is in Publica, we've formed a very strong sort of a relationship with the GP that is just right above us, and over time talking to him and cross-referring people, because we send patients up to him to do x-rays, he sends his patients down to us, who have either a low back injury or a knee condition or something like that, and it's nice to see that kind of a collaborative kind of process taking place.
Yeah.
So I guess to answer your question, it was just an opportunity, but we could really see that being in the suburb that we are in, we could really speak and really connect with the people around. Yeah, in what we could do. Yeah.
Awesome. So like now that 6 years down the road since the inception of Spinefit Chiro, like what have you seen that it's just remarkable, like it's a total testimony to what you and Dr. Aaron started out with. Like what do you feel like, I mean, in just a quick short answer, like what's something that you felt like has really transpired that you never expected ever since you started this company?
What we never expected?
Yeah.
I think to be honest, what we never expected would be the uphill challenges that we would go through in terms of, either it's a mindset change, or it be gaining the trust from people around, people who actually have gone to see a chiro before or a physio before. People always say, oh, what's so different about you? I think the other challenge as well, I think would also be, because the team is generally much younger, people come in and they're used to an old school of thought where, old is better, old is gold. And then, because of the experience, then they're like, oh, do you have the experience? But that was one of the things that kind of like surprised me. But I believe like these guys have done a really good job in terms of really putting themselves out there and yeah.
Okay.
Hopefully.
Very, very cool.
Hopefully the experience outweighs the age.
Yeah.
Awesome. Well, by the way, just a quick shout out to this guy who's just joined in the IG Live, Hershey. He's actually a personal trainer that I just met yesterday for the first time.
Hey.
And he runs this amazing clinic,
Awesome.
this gym in Singapore, and they have great causes like for youth at risk, people with teenage abuse and teenage pregnancy and stuff. So I mean, it's just amazing to meet people who have like-minded like us, who actually have the patient at the center of their interests. So quick shout out to Hersey.
Nice. Hi, Hersey.
I think
Hersey.
like
Good to meet
I think sometimes people are so afraid to work with other people because they have this idea that
Don't steal my rice bowl.
either don't
Come
steal
on.
my
Yeah,
rice bowl,
that's
or
right.
either don't steal my rice bowl, or it's a case of like might show that maybe I don't know something, that kind of thing, which is very weird because I always thought that, I mean, having been overseas for a while, maybe it's just overseas thing, I don't know.
Yeah.
But you always have this understanding that, if you don't know, you ask. And I think and when we first started this place in 2014, that was like 6 years ago, right? I would reach out to other PT, all this, what do they call it? All this HIIT and functional training stuff, boot camps, and all these people. And I would reach out to them, and I would say, taking a different angle and a different way to look at it. I say, hey, why don't work with us? We will help rehab some of your people, if they're injured. And either it's through physio or through chiro, whichever that's needed. And then once they get better, they will get back into your training for whatever it is, and they will have a longer journey in terms of their lifestyle. It's a healthier lifestyle, right?
Yeah.
But a lot of them approach it with a very kind of like, oh, you're going to steal my customers, But the way I look at it, it's like, and then when I go to the gym and then I listen out to when people are doing their workouts and they're doing group classes, and then you have this guy out there going like, oh, Maggie, oh, I know you've got like a knee issue, so you do this regression. Oh, Bob, you've got this backache. I think you should do this regression. I'm like, dude, how many regressions are you going to do for one class? Why don't get them better, get them rehab, and then they can actually level up in terms of their training. So I think when people, I won't say all, but I think when individuals don't put the person there as their primary focus in terms of where they want to go, then that's the challenge, I believe.
Yeah. That is so true. That is so true. Like laying aside your pride and stuff. Actually, like before we kind of get into the whole practical stuff, like what actually patients, like behind this whole, like the explanation, the vision and stuff, like they want to know, how chiro and physio can help with your pain and different painful conditions and stuff. I really want to touch on this thing that I really felt on, that I was so drawn to, like for me as a chiropractor, right, as a doctor, I'm always trying to, like acquire as much knowledge as I can, right? Like I'm doing this to advanced courses and stuff. And I think that the danger of a medical professional, all across the board, right? All across healthcare. Like in Singapore, we have the main healthcare system, we have the allied healthcare system where we have all the therapists. Like my wife is a speech therapist, so that's also an interesting combination, right? To actually have everyone in this healthcare system, you have the onus, like the onus is on you to upgrade your skills, right? But I feel like the danger of upgrading your skill as a medical professional is that you start to get, for lack of a less harsh word, like you get more cocky. Because you go like, hey, I have these letters behind my name, right? I'm a lot better, and you actually start to put up this front, So this is something that I personally do see myself getting into as a possible danger, like as I learn more, how they say knowledge is power, right? But the power can actually be, if you actually use it well, we can actually turn that knowledge, which is power, can turn that power into actually transforming the patient's lives by getting other people involved, and not just saying, hey, I have so much knowledge, I'm the most powerful, send me all your patients, right? So I love what you guys talk about stealing the rice bowl, because this is what I personally encountered when I first joined the medical field here in Singapore. Like when I said, oh, hey, I'm a chiropractor. Like when they hear the word doctor in front of my name, they go like, oh, you're a medical doctor. I'm like, no, I'm a chiropractor. And then they attach all these different, just like public stigma, right? Social stigma with chiropractic. Oh, you just crack people, And a lot of patients they start to go like, oh, doc, I don't think you did a good job because the crack wasn't as big as the one I saw in the YouTube video. And I really want to touch on this because I literally just this week, right? It's been day 4 of my work week this week, and I had almost 10 patients, and they showed me this video. They said, hey, doc, I realized that the way you do chiropractic is very different. Like I saw this video of this chiropractor in the States, right? And they had 1 million views on YouTube, right? And all they did was crack babes, like Grace in bikini.
Yeah.
And then there was another video with all sorts of stuff. So it's it's like the category of patients that is enticing, that gets the YouTuber reviews, but not actually the craft of the craft that the medical professional has honed over the years. So it's kind of like we see this spectrum, all across the world. Like people just not stewarding the craft well, and they start to go like, hey, I'm aiming for the money, you know, and then they get patients in and out as if they're just dollar signs, but then they forget that their knowledge actually has the power to change their lives and not to just earn money, you know. So that's something that really drew my attention, and I guess now I am, for lack of a better word, I'm just so much more cautious of where this knowledge takes me, you know, and as we're learning from each other, like we are now, like it just makes me so humble to go like, you know what, I don't care how much I know, like, if my patients don't understand that I care for them, right, it doesn't make any sense, you know. There's zero relevance to what I'm learning. Because I mean, knowledge is power, but money is knowledge too, right? Like you're spending money to upgrade yourself. So sometimes you can just get caught in the rut of money, like getting money to be the stronghold in your life and stuff, you know. So we just wanted to move on really quickly to the next question. So this is actually when we get into the practical side of things. So for all your patients, like I said, for the 5 of you guys who just joined, if you guys have any questions about how chiro and physio can help you, why don't you just put in your questions in the questions chat, and we'll get either one of the 4 of us to share with you guys their answers and their inputs. Okay. So we're going to go into the practical stuff now, stuff that actually patients are, I guess, a little bit more interested to find out about. What does chiropractic actually do for the patient? Okay, what does chiropractic actually do for the patient? So Dr. Chandra, I spoke a little bit about that during my first IG live, but I'd love for you to speak into that for us.
Yeah, so I guess I'll talk about it in from my point of view, okay? So I'm more of a chiropractor that looks at the body in a functional sense. So how the patient moves, you know, their movement pattern, and then also looking at the muscles and the joints and everything, okay? So basically when I explain to a patient, usually when they come to see me, I'll just tell them that basically what I will do is I'll help a bit with pain relief, so with the adjustments, all right, and help you feel a bit looser and a bit more mobile, all right? And then I also look at you in terms of functionally, so how's your hip moving? You know, maybe if there's a bit of issues in your hip, it could be affecting your lower back. And I don't just look at one specific point. So if they come in with low back pain, I don't just look at the low back. I also look at the hip. I also look at the ankle, you know, same thing with the neck. If they come in with the neck, I don't look at the neck alone. I look at the shoulder, I look at the mid back. So it's like, it's not just one specific point, and it's not just tailored just straight to the spine. It's more of a broad, broad view of the patient basically. And it's more just to help them with pain relief as well as the mobility side of things, you know. And I understand when you say that patients come in and they're like, oh, you didn't get the crack, so you know it didn't work, you know, and stuff. I understand that as well, and I try to stress that to the patient as much as possible, that don't worry about the crack, because just because the crack isn't there doesn't mean it didn't do its job, you know. Because at the end of the day, you might not get the crack, but then when we recheck your range of motion, it's better, you know. You're able to turn more without pain, so you know, those are the things, you know. So I guess that's chiropractic for me, you know. And that's about it.
So how have you seen yourself as a practitioner, as a doctor of chiropractic? How have you seen yourself develop over the years in terms of educating the patient? Because that's something that I'm really focused on in Chirogenesis here in Singapore. That, like, if the patient comes in with more questions, if the patient leaves my clinic with more questions than when they first came in, I don't think I did my job.
Okay, true.
I got this pain. This is what I filled out in your history intake form, which by the way, like, I take a lot of pride in my history intake form, because my focus on you. Like, I want you to give me as much information as you can. But if they leave the clinic knowing that their questions weren't answered, and they left with more questions, I feel bad because I don't think I did my job. So how have you, Dr. Chandra, actually, I guess, change your perspective, or how have you developed over the years in terms of making sure the patient feels confident leaving the clinic? So not just having received a great adjustment, but also in their brain and go like, wow, I really understand my body a lot more now.
I think there's a few ways to do that. So first thing, like usually that I always do, I always show them. So maybe like what Hannah does, I know, is she takes the iPad and she shows them on the thing, so they can see which muscles are affected and stuff like that. But for me, it's more about showing them where their issues are. So if like they've got a bit of glute weakness, I get them to do a glute test, and I say, look, this is, you can see that you can't actually push so much, okay? Or you can see that you're compensating a bit on the other side, and then they'll be like, oh yeah, okay, I can see that. So when I explain to them, I sort of do it again. I do it in the test, but then I sort of do it again so that they can see. Same thing with like stuff like stiffness. Let's say they come, oh, I feel really stiff, I can't turn my neck. So what I'll do is I'll check their range and I'll say, okay, look. And then usually when they turn, they'll be, let's say they'll be able to turn to the right side more than the left. So I'll be like, okay. Then when I adjust, I'll check again and I'll say, look, you'll be able to go more now. And then they'll be like, oh yeah, actually that's true. Yeah. I think I'm the same as you, is like, in the sense that I promote questions as well, but I'm also not very, I'll be honest, I'm not very patient. So like sometimes patients, when they ask the same questions over and over again, I'm like, oh my God, look, this. But yeah, yeah. But I think at the end of the day also, it's, you have to be okay with not knowing the answer. I think that's something really important as well. Because there have been times like patients will be like, oh, my neck is like this, but I also got this pain in my arm. Do you think it's related and stuff? Then I'll do the test, and then like the test that is specific for that, and there's no real positive or anything. But then I sort of just tell them, look, I'm not too sure what's causing this issue, but maybe we can trial a few treatments and we'll see what happens. If it doesn't work, we'll get a second opinion. That's when like physio comes in, or like we discuss with the team and stuff. So I think not knowing the answer it's not a bad thing. We always think that, oh, we don't know the answer, we might give the patient the assumption that, oh, we don't know anything, but I think like as long as you reassure them that, hey, okay, look, I don't know the answer, but I'll go and find out, okay, or I'll do my best to work with other people to try and find out the answer for you. So that's about it.
That's amazing. Yeah, that's actually the spirit of excellence that I was talking about early on. Like we are all, the onus is on all of us, right? All of us at board in the medical profession to upgrade your skills, because if you think that what you know already is all that is enough for the patient, no matter how much you try to collaborate with someone else, like you're always going to hit a plateau, because there's always going to be a moment where you go like, you know what, I just don't think I have enough anymore, and I just need to depend on others. And others are like elevating themselves because they take pride in the work, but you're not. So I really love the fact that you said that don't be afraid to tell patients that you don't know, because I experience that every single time. Like it's funny. My mentor in chiropractic school first told me on day one, is that you will find patients come to you after your first quarter of school, saying, "Hey, doc or student doc, like help me," and then like you have so much stuff that you don't know. And he says that you think that your questions will diminish as you finish school or throughout profession, but actually it doesn't. The questions just keep growing because you just keep getting more inquisitive and you start asking more questions. So I really like that perspective. That's awesome. Okay, let's move on to Hannah, the amazing physiotherapist. How are you? So what do you feel physiotherapy actually does for the patient in your experience?
My experience, physiotherapy really helps people to understand their movements better, and it also challenges those movements. So it comes to collaboration again. What do you do when a patient has gotten into trouble or gotten an injury or gotten pain from a movement? They come to you and they want to go back to that movement again. But if you do that movement again, they get more pain, right? So it doesn't make sense. So what I found is that after they've seen a chiro, it really makes my job so much easier, because they've seen a chiro, they are in a space where they feel mentally and physically, they feel safer to move, they're out of pain. And when they come to me, then they're like, okay, we are not starting from ground zero anymore, we're starting from a base where they already feel safer. So helping them, then it's my job after that to help them further understand what caused the problem in the first place, maybe some movement patterns or imbalances that were contributing to that, helping them to understand it, and then next, challenging it, because you can't stay pain-free forever, right? There will be instances where you actually like accidentally do the wrong thing and then the pain comes back. So it's part of physio is also helping them to understand their body better, and also helping them to, okay, if the pain comes back, what can you do? You're challenging their notion that chiro or rehab equals to pain-free forever.
Come on. Yeah. Wow, that's really amazing. So have you had any instances in your, like could you give a quick, like a quick patient testimonial, like where you realized that there was this I guess more of a personal revelation to yourself. Like you go like, hey, you know what? I really need like Chandra's help. You know, I really need a chiro's help. Like, what was that defining moment where you went like, I need someone's help?
Sorry.
Well, I don't think there was any specific defining moment, but I clearly coming from a background like in clinical postings where it's just physio based, and then your first job you have to work with a chiro. There is like a clear demarcation of this is the mark. This is where I've only worked with physios, and this is where I've worked with chiros. And you can see that the patients really, they feel better because they feel like, you know, that the patient, well, you as the clinician care for them because you're willing to refer them on to someone else.
Yep.
You're not just protecting your rice bowl, you know. Like I've had a patient recently where I've been working with her after knee surgery, and she's almost gotten back to running, but then she really wanted to focus on her performance. And then she asked me, should I just stick with you or should I find someone else? Because I really want to go back to a higher level. And to be honest, I told her honestly, like, I have no performance background. Like I'm not a professional athlete. I don't bodybuild. I don't do the things that you want to do. I've only gotten you so far. If you want to look for someone else to further progress that, someone you can trust, then go ahead and like just get them to contact me if they're willing. I'll be willing to share with them your progress so far. So she actually went to contact a really good personal trainer somewhere around the area as well, and he willingly reached out to me. We discussed her case for a while, and we all felt confident enough that he could take her from there. So yeah, it's not just about chiros, but also about, you know, other people like personal trainers, functional fitness trainers also.
So have you had any instances where someone actually approached you and said, hey, Hannah, let's work together? Has anyone else, I guess, besides in like within this office, Spinefit Chiro Physio, like has anyone else ever approached you and go like, hey, Hannah, can I get your input? Or can I work with you? Anything like that? I
think that personal trainer was the first one, which was like, it was a new thing because I like what Keith mentioned, you know, people normally aren't too keen at all.
Yeah. Okay, right.
It's a good start.
Yeah. Okay, very cool.
I mean, just on that,
go ahead.
Just on that note, right? I mean, just based on that example that Hannah gave, I mean, that's the clinical side of things, right? I mean, the three of you guys are clinical, and I'm here like an outsider as a business person, right? Now, if I look at it from a business standpoint, I think that's completely stupid if I were to use that word, because I'll be telling her like, Hannah, what the hell are you doing?
The patient asked whether you could continue. Why didn't you say you can continue?
Yeah. You know, but if I take that view, I'm not going to go anywhere. And I'll tell you the reason why. It's because if the patient stays here longer, but their desire to get better, she's not she said it that she's not equipped or trained to be there, and she doesn't intend to get to that level, right? And why am I forcing two individuals to actually do something just for my benefit? It doesn't make any sense to me, you know, in that sense. Yes, it doesn't make business sense, but if I were to look at it from a point of, hey, this is about the patient here, and you know what is best for them, then by all means go, you know, because the way I look at it is like, if they go and they do get injured again, which, you know, the likelihood of that will come, then at least she knows that she has that trust that she's built with us, you know.
Keith, I don't want to steal your thunder because you mentioned this to us when we called you last week, but you mentioned something about how if you want to run far, you know, could you just talk on that, because I felt that was such an empowering statement for myself as a medical professional, but could you just touch on that a little bit?
Yeah, sure. So like in the past, I think we were also still finding our way, you know, coming to this place of where we're kind of like easy to work with each and everyone. It's not something that took place overnight. You know, we have individuals in the past who like to stick to that specific way of working, and I think that's completely fine. There's nothing wrong with that. But what I realized, and being, you know, managing a team of practitioners, and what I realized is that, you know, if you want to go, and it's this African proverb which I came across, and it's become our core value here. It's like if you want to go fast, you go alone, right? Because it's your capacity. It's you. It's what I can do, right? But the thing is, if you want to go further, right? And I'm looking at it from a sustainable point of view. from a longevity point of view, then let's go at it together. Now, if you look at so if you look at the birds that do this cross-migratory thing across continents and all that kind of thing, and they fly in that V-shaped thing. Now, the person at the front, or that bird in the front, he's not going to be there all the time.
Yeah.
There's a rotational thing that they do within this V-shaped thing that they fly, and they take turns to rotate. And that's why they can travel that distance across continents, you see.
Yeah.
So as humans, you know, I'm sure that there will be something that we can learn from the animals, but it's coming down to self, right? In the sense where you have to give up that ego side of things. You just have to set aside that, hey, I may not know everything, but Hannah knows more than me in this area, then I'm going to just work together with her or something. Chandra knows something better. Or it could also be maybe a Pilates instructor that does something where that's when we reach out to them and I say, hey, you know, that sort of thing.
Yeah, wow, this is amazing. I really love it. I mean, if you guys haven't heard it yet, Keith, don't mind if I say it again, but if you want to run fast, you run by yourself. You want to run further, you run together. You know, it's just a really empowering statement. We're going to get into a time of testimonies. Actually, just want to quickly touch on something that I personally experienced. So I'm about to become a father in September.
Oh, congrats!
You know, and it's
Welcome
just
to Sleepless Night.
Yeah, I'm about to become a father in September. My wife is well into the second trimester, and she, you know, I was like, I've been adjusting her. You know, she's been getting a lot better, but there was just this part about her pelvic floor that needed more work, you know, and I'm like, who can I engage, right? So I actually engaged some physiotherapists at my workplace and stuff, but I guess because of how new I am into the business, I just don't think that there was much accountability in that sense. Like there was no one that really could do that does prenatal Pilates. And then when I reached out to the people there and I put it on Instagram, all of a sudden my sister reached out to me and said, hey Ben, so my sister's a Pilates instructor. And she said, oh my gosh, I'm actually doing this prenatal Pilates course.
Yeah.
So just last Monday, we had, my wife had her first prenatal Pilates course by my sister.
That's good.
And it was just so amazing to see, like, I was adjusting my wife, and then all of a sudden, like, I mean, just right after that, it's so seamless that my sister just took on her case. You know, it's like, and then my wife came home feeling like she could, she was just a more well-rounded, all-rounded, more, like her well-being was just so much more powerful.
Yeah.
Oh my gosh, my wife just joined this IG Live. TPS, how are you doing? Baby, I love you. We're just talking about how we got Belle, my sister, to do prenatal Pilates with you. And it was just amazing. So good, so good. Okay, so let's get into the time of testimonies before we get into the point questions. So because of time constraint, maybe Dr. Chandra, if you can give one powerful testimony in Spinefit Chiro Physio, where you guys actually saw just so much improvement in the patient because you guys chose to, maybe you can talk about the specific condition that the patient suffered from and how the collaborative effort helped them.
All right. So I think one of them, it was, so basically this guy came to see me. He's a bodybuilder, sort of like, he likes to do lifting and stuff like that. And he lifted, I think he did shoulder press or he was doing clean. I can't remember the case very well, but I remember the whole process. Yeah, I think he was doing clean and press. And I think when he was about to press, he pulled something in his lower back. He felt like something jarred. All right, so he came in the first day and he was like a bit he walked in a bit gingerly and stuff like that. I did all my usual tests and stuff. It just seemed, it was basically just a muscle spasm, like really bad muscle spasm. That's about it. All right, I could have been worse. Clean and jerk and stuff like that. So I just did my usual treatment, released the muscle, did my adjustments. When he woke up, he was like, "Oh my god, like there's nothing," you know. But I did tell him because he stated to me that, usually when I work out, if I work out, let's say I go running and stuff, I usually get some low back pain if I run for long. And then sometimes when I do squats and things like that, I feel my lower back a bit. So that got me along the lines of thinking like, hey, maybe something's up with his hip, something's up with his glute, the way he moves and things like that. So then before he left, I just did some glute testing. And then I noticed that, hey, both his glutes actually don't activate. That's probably why when he runs and things like that, he's probably putting a lot of pressure on his lower back. And his hamstrings were super tight as well. And he says he stretches them a lot, but they just feel tight. So I was like, okay, this is looking like basically he tried to lift and his glutes didn't fire and he pulled his lower back. That's basically it. So that's when I referred him on to Hannah. And Hannah started getting a lot of good results. And I was still doing my adjustments. I was still doing my adjustments with him. Like it was once a week. And then I think we progressed to 2 times, once every 2 weeks. And then eventually we got to a point where he went to maintenance care, which was really good because he literally would come in. He would have no issues. We just adjust him and he'd head off. The thing about this patient, and I think that's where Hannah was saying and what Keith was saying, that even though we, for me, because he was my patient, I could have been like, nah, I don't want to refer. I'll do everything myself, because I do have some experience with glute inactivity and stuff. I know the exercises. I could have just been like, nah, I'll just do it myself. But I didn't want to lose. I could have just been, I don't want to lose this patient, so I'm just going to do everything myself. But I referred her on to Hannah. The thing about this guy is, literally, I think about 2 months into doing maintenance, he pulled his back again. And this was, I think, basically same thing. He didn't stretch. He didn't activate the glutes with the exercises we gave him. He tried to squat and he felt the pain. So we just did the same thing again. We got him back to a certain point where he was no pain. I think then and then after that, he didn't come back for a while, right?
Yeah.
I remember it was about 3-4 months he didn't come back, and then something happened again. He came back, and this time actually the adjustment didn't work for him.
Wow.
This time actually the adjustment made him worse. He struggled to stand up and things like that. So in that case, I was I could have just been like, no, it's okay. I'll still treat you. Don't worry. Today was just a miss. You come back tomorrow, But the next appointment, I booked him in with Hannah. I got him to see Hannah, and Hannah was actually Hannah actually did quite a lot of work for his muscles and things like that. And then we slowly got him back to now he only comes once every 2 months for adjustment. Wow. Yeah. So I think that's the positive way of it won't see, it kept coming back, and sometimes it might not go the way that you want it to go. You think okay, this guy, he always responds to adjustments. Let's just adjust him, But clearly this time it didn't go that way. It didn't go that way. So we had to look at it from a different avenue. So maybe he needed to do a bit more physio, maybe a bit more activating exercises and stuff like that.
Yeah.
So
that's amazing. That's a great example. Wow.
And if it weren't for the fact that Chandra had referred him earlier on, and we had already built a foundation, it actually made that the most recent or the worst recurrence, it made it a lot easier to rehabilitate back.
I think it's from him as well. He trusted us, even though he felt bad. He trusted us. He was like, okay, never mind, I feel bad, but I know you guys will get the job done. Yeah. So I think that's a good thing. Yeah.
Wow, that's amazing.
Yeah.
So, Hannah, do you have another testimony that you can share with our audience today?
There was a case of a young guy who came in, who was really very young, younger than 20 years old, kind of young, because everyone here is older than 20. So everyone below 20 is really young.
Yes.
So he wasn't sure how he injured his back, but he came in and he had difficulty walking. It was basically it seemed like a disc issue because there was some numbness, there was tingling, and there was a bit of a reflex, diminished reflexes. So in those cases, because he had difficulty with turning and lying down, it was basically very sensitive. I didn't refer him onto the chiro first because sometimes the positions that you put in it might aggravate it a little bit more. So this is one of those rare cases where we started off with a physio first. We did some exercise to stabilize, to desensitize it. And after a couple of sessions, he was like, yeah, I'm pretty much back to almost 100% normal. It's just like that, that one thing I just can't put my hands on. I was like, you know what? I'll refer on to the chiro because I'm sure he will see something that I don't see. And I think after one session with Dr. Chandra, I think he did an adjustment for him. He was like, okay, I'm 100% now.
Yeah. Wow.
I mean, I could have continued seeing him and trying to do something and charge more for more sessions or something like that. But why do it? Why do that when you have a better option?
Yeah.
Wow. Okay, so maybe you guys can speak a little bit into the so right before we get into Q&A, maybe you guys can speak because Hannah, you mentioned something about how this one of that case that you mentioned was one of the rare cases that the patient came to see you first, right? So maybe you can talk a little bit about what the natural flow of events is in Spinefit Chiro and Physio. Like, what's the main flow of events? Like, does Chiro happen first, and then Physio? We are
Okay.
good. All right, guys. Hope you guys can jump back on. Sorry for the technical difficulties.
All right.
Okay, let's see.
Song?
Sorry?
Did you sing a song in the
I
meantime?
didn't. I was more concerned about where you guys went.
Yeah, technical difficulties.
No worries. Don't worry. We used
Yeah.
to.
Hey, if you guys can just give a shout out to the amazing Spinefit Chiro and Physio who just fixed this thing for us. Awesome. Okay, where were we? Maybe just give like a quick minute for them to jump back on.
Yeah.
I think there were some questions earlier. So maybe I think earlier was about what if someone's come in who has already been seeing a chiro, and then they come in and want to see a physio, or vice versa, right?
Yeah.
That's it.
Yeah. So see if you, maybe let's just answer those questions if possible.
Yeah, the question just now was, what if the patient is already seeing a chiro, but you feel like they need to see a physio and they are not keen? What do you do then?
Oh, okay. So, Hannah, do you want to talk about that since you're the physio in the room?
Or vice versa. That was part of the question as well.
Okay.
I don't think I've actually had any patient unwilling to see a chiro. Maybe thanks to all those YouTube videos where, it looks really interesting and like, oh wow, an adjustment with the sounds, right? Oh no, there have been some patients who were quite unwilling at the start because they have been told that it was dangerous. They did go eventually. So it's about just educating them on what a chiro actually is and telling them that it's really safe because the chiro does their own assessments to make sure that what they do won't harm you.
Yeah, so true. Yeah.
But in the end, the ball goes back to the patients. It's back to the patient's decision whether they want to or not. I could say that, you really need to see a chiro, and if they still don't want to, who am I to force them to do it? Because if they come from a place like, you're forcing them to do something, they don't trust you anymore. You're kind of breaking that trust with them.
Right. Totally. That's so true.
Chandra, but I think Chandra will have more experience with his patients not wanting to see a physio.
Yeah, maybe you can speak into that, and maybe speak into how you managed to, not really convince, but you educated them on like the power of physio. So give us some examples.
I guess for patients, right? They want to be in control. They don't want you to tell them what you think they should do. They want to have the ultimate say at the end of the day. So I have had patients that come in and I explain to them and be like, look, this is the issue. You need to do chiro, but you also need to do physio because it will help you in the long run. I've also had people who have been coming into the clinic for a long time, but aren't too keen to do physio because either they know what they're doing or but the pain is still there. I think at the end of the day, it's all about just managing their expectations, I guess. So like for those, let's say it's a new patient who's come in and they're like, oh no, I'm not too keen to do physio. Then I'll just explain to them. I'll be like, look, this is the issue. Okay, this is what the physio will do. They help strengthen the muscles. They look at your movement patterns and everything. If you don't want to do that, it's fine. But what that would mean, maybe you'll have to do a bit more chiro sessions then. So instead of doing it once, your maintenance might be, instead of doing it once a month, you have to do once every 2 weeks, And I said, even then, that's not something that will, that's not something that will solve the problem, Sometimes when I put it that way, I know I'm not trying to scare the patient. I'm just trying to be as real as I can with them. Because the last thing I want is to tell them, okay, if you do chiro twice a week, all your pain will be gone. Don't worry, even if you don't do physio. That's a lie, at the end of the day. But I think by telling them this, at least it's their decision basically. You know, I told them, look, this is the best way to do it. There's also this alternative way, but it's not. Maybe it's not. It can get you to probably about 80%. The rest is, you know, like you need to do the physio side, and then it's up to them basically. I mean, I think I was always this person. I used to be this person where I'd be like, okay, you have to do this, you have to do this, you know, you have to do this, and then like not even worry what the patient thinks. No, you have to, and then and like I think I don't know if I mentioned this to you during our other talks before, but like the way that I can gauge where the patient's at so is during each initial consult, I always ask them, what's your expectations of this session?
Yeah,
what's your expectations of the whole process? What are you looking for? What are your goals? You know, and then from there I can sort of tailor the conversation. But it is hard. It's not easy.
It is
There
definitely
are
hard.
patients who, like, no matter how many times you try to explain, they just don't want to do it. But I guess that you just got to tell yourself, okay, you've done all you can. You know.
Yeah. And also, like what we touched on early on, to not be afraid to tell them that you don't know the answer.
Exactly.
Right? And someone else that you work with might actually know the answer.
Yeah.
Exactly.
Really good. Yeah. Especially coming from an Asian background too. You know, like, I mean, KL, Singapore, we had pretty much the same population, but people are always more geared towards like the traditional side of things, right? Like traditional medicine, TCM, acupuncture, cupping, and stuff. So it's almost quite interesting to see how the older population, like those who are in their 50s and 60s and all the way into the 80s and 90s, can actually open up their hearts and receive chiro and physio. You know, like a lot of them are just like, I just want to stick to the needles. I just want to stick to Chinese medicine and stuff. So it's really up to us to educate them and not be selfish and acknowledging that we don't know everything. Yeah, that's really. Is that something that you guys see in KL too? Like a lot of TCM.
Yeah, I think so. Like just to give a recent experience that I had, I was just scrolling mindlessly on Instagram once, and then I saw a friend of mine who he plays futsal, pretty much I think as a social level. Although he's a professional futsal player, but this is my friend, right? But he's my friend too. But this other friend of mine, and he showed himself at like a traditional Chinese medicine, clinic thing. And then I'm like, oh my gosh, what are you doing? I mean, it's not that I have anything against them, but notice that my friend, he goes to the gym regularly. He's really into his fitness and, he's very active and all that. And I was thinking to myself, for someone who's so active, I would have thought that at an injury, he would probably go and see either a physio or a chiro, whatever it is that was the injury. So I reached out to him and I said, hey, what's wrong? And he said that, I injured my ankle while playing futsal and all that. And my boss actually told me to come here because she said that, it works. It does miracles. And I'm like, dude, do you even know what's going on with your ankle right now? I said, how often have you had your injury? And he's like, it's actually reoccurred quite a few times. And I said, that's because your ankle is weak. I said, you need to work on the strength of your ankle. And get this right, I'm not a professional. I'm not a medical practitioner. But I've been here enough to know and to spot, what he needs to do. And I said, look, I know where you live, and it's quite far to where our center is. And I said, let me look for someone who's closer to you. Where are you? And I did the background work, and I found people who were physios, but more sports oriented because of what he does. And they would understand, his movements and everything. So that's what I did. I reached out to the other person, and I said like, hey, I've got a friend of mine who's looking for a sports physio. I know you guys, you live quite close. Said, do you guys want to connect? He was like, yeah, sure, and I was like, yeah, happy, just go, and it's that kind of thing. So I think among the young in Malaysia, and maybe it's the same thing in Singapore as well, people are still quite comfortable to go and see a traditional Chinese medicine person only for the fact that they think that they're a miracle worker, one hit and it's done. But our bodies don't work that way, right?
Yeah, totally. Wow, very true. Yeah, that's a great insight from someone who is not medically trained, but you spot on. Like that. That's really the heart behind it as well. I want to touch on some of the questions that came in. So quick and easy tips to relieve the low back pain and neck pain. So we've got the best of both worlds here. We got the physio, we got the chiro. So, maybe both of you want to speak into a little bit. I can share a little bit about the chiro aspect to it, but Hannah, you want to talk a little bit about the physio approach to neck pain?
Quick and easy tips to get rid of neck pain.
Yeah.
Have you tried lying down? No. I mean, a lot of times pain happens because you're stuck in one position for too long, right?
Yeah.
So maybe one of the things that you can do is try and look in the mirror when you're feeling that neck pain. If there's a mirror near you, like use your phone and see what kind of position your neck is in. It could be that you've been sitting for a really long time doing work and your head is just going forward and forward and forward and tensing out and trying to see the screen and avoiding your boss or something like that.
Yeah.
So if you're noticing that, do the opposite movement to kind of get out of that position. I know it's like really cliche, like common sense, but you'll be surprised at how many people don't realize that they are stuck in a position and that they should move out of it to relieve the pain.
Yeah.
I hope that answered the question.
Yeah, totally. Chandra, anything?
I usually just tell patients to try to stay as mobile as possible.
Yeah.
So like if you're a desk worker or you're someone who sits for a long time, try to get up every half an hour to 45 minutes. It doesn't have to be like a big workout. Just move your neck around, move your body, just do a few stretches, and that's about it. Like usually you'll be surprised how much movement can help, Yeah.
That's amazing. That actually brings me back to day one of school. I remember we learned in spine physiology 101, and my professor was like, if you guys have to learn one thing in the first week of school, is that your spine thrives on one thing, and that's movement. And that actually has been my pet phrase that I've been saying to all my patients. Like if you have so in my history form, I'm sure you guys have it too. You guys have the patient's occupation, right? And if I have if there's some semblance of sitting for too long, or if I just go like, you know what, I think you sit for too long, I will make sure that you understand that moving is going to be the number one thing. So one question that we face here a lot in Singapore is, what exercises can I do to be better, right? And a lot of them, they actually take on that approach and they sign up for classes, they sign up for a gym class at the end of the day. But throughout the entire morning and afternoon, they're just seated on the chair, grounded, right? And not moving. And they expect to feel better in that 1 hour session of gym, after work. But the whole time from 8 a.m. to 5 p.m., like they're just seated on the chair, not doing anything. And they're going through headaches, Panadol after Panadol, salon pass after salon pass. So it's just something that is really lacking in the education here. Like we gotta move our bodies to actually feel like to let it work the way it was designed to work. I mean, we can go into the whole science about how your spine, has fluid coming in and out of it, and the only way you can do that is for movement to happen in the first place. So it's something that's so crucial. All right, one last question, because I know we have time constraint. Why? Hold on, let me see. Why is it that some massage made me worse, but some made me better?
Some what? Sorry, massage.
Yeah. So like some sports massage. So I guess we can kind of tailor the question. Like, why is it that some chiro made me worse? Why is it that some physio made me worse? Right. And how and what's the fine line between it? Like how like for a patient who has heard of stories that chiro hurt them, and for patients who have heard stories of how physio has hurt them, how do you guys see yourself as a collaborative focused clinic, like work towards that, like bridging that gap?
I think like what I tell all my patients is different patients respond differently to different treatments. I've had a few patients who are like, from the physical exam and history, it seems like pretty clear cut, like it's just an adjustment, it's a bit of soft tissue, but I think also the other thing is, like I said, different patients respond differently. So is it that they feel anxious about the adjustment, that they tense up when they're about to get adjustment, which makes them worse? That could be something. Is it maybe that they are super sensitive in the way that they feel, like any small pressure can make them scream, like I think our previous chiro had a patient that she treated, and she went away and she had a fever for 3 days or something like that. And body ache all over. So We all thought it was COVID, so we were a bit worried, but it wasn't. It was literally from the adjustment. So different patients just respond differently. Some a bit more sensitive, so maybe they prefer physio, like in the sense of that active with exercises and stuff like that. Some like it like super, like hard and stuff like that. So we just, So it just depends.
That's great. That's great. Yeah, that's something that I make an attempt to say to my patients as well. Like, I mean, if you're listening right now and you're my patient, like, I always make sure I explain to you guys that if your body has been inflamed for so long, physical, like, forceful manipulation, and by forceful, I mean, like, quick and fast, but not a deep, like, as if I'm going to fracture your bones, right? It's just a quick adjustment to your spine or any other joint in your body for that matter, can actually set off that inflammation cycle a little bit more rigorously. And that's why you might feel a little bit sore. So like what you said, Dr. Chandra, about managing the patient's expectation, if you kind of say it up front at the start of the consultation, go, hey, after the adjustment, you might feel sore for the next 2-3 days, but it's completely normal. That actually starts to get them go like, oh yeah. And then when they actually feel sore, they go like, oh yeah, Dr. Ben said that. Hannah said that. Dr. Chandra said that. But if they don't know anything, if we don't say it and they feel sore, that's when they go like, you ref me up. Like, you ref me up,
Yes.
That's so
Communication is so important.
Yeah. Hannah, did you have anything about anything you want to speak into how physio can, I guess, examples or testimonials of physios, like you exercise actually make someone worse, and then you have to refer them to.
Yes. Oh, so many, because like I mentioned, it's getting them back to doing the movement which actually hurt them in the first place, right? So sometimes there is a fine line between increasing their load capacity for being able to handle bigger movements that they need, and also not doing so much that you actually hurt them in the trigger and inflammation, like what you mentioned. So there have been many times where after a session, I always tell them, like, I've learned my lesson. I always tell them you might be a little bit sore. If it's really sore, and I use the pain scale, this is what I've learned in one of my further educations, like CME, continuous education stuff. You give them a pain score 0 to 10. Anything more than 5 out of 10, tell them what it feels like. And if anything more than that, tell them to stop and ice. If it's a discomfort that's below that, it's tolerable. Just continue. It's the load that you need to get stronger. So once they understand that exercise isn't a zero-sum game, it's either no pain or totally painful. They know that there's a balance. It helps them with their recovery a lot.
Yeah. Wow. Actually, kind of one thing that I want to touch on before you wrap this up was that they're showing in the latest neuroscience research that the more diversity that you give your brain, if your brain is getting new movements from time to time, you actually mitigate the pain signal. So sometimes you kind of have to work through the pain, but obviously that has to be exercised with caution, and that's up to us as professionals to go like, hey, I think this amount of pain that you're feeling, that actually can be alleviated to some degree before you actually go head deep, into trying to work through the pain. Because there is truth to that, but there's also truth to not working through so much pain, because that actually makes it worse. And pain is often the biggest yellow flag, because that's the one that diminishes you. I have a lot of patients who go like, I refuse to bend down and tie my shoelaces, and I stopped wearing shoes with laces because bending down and tie them just makes me worse. So those are the stuff that kind of makes me go like, I would love to get you out of that situation where you can actually start to tie your laces again, because tying shoelaces is supposed to be part of your normal routine. Right? If you have to not bend down to pick up your stuff from the floor, then you might as well not have laces. Right?
Yeah, that's true. That's true. A lot of fear avoidance behaviors can be trained, but it takes time, and it takes a lot of trust as well. Yeah,
totally. I love what you said about this is Jonathan had this question. He said, sorry, I'm not sure if this is a valid question, but my elder brother had his arm dislocated. He went to TCM. Let me just quickly touch on that a little bit. When the arm is dislocated, when it comes to the shoulder, the biggest risk factor in the research right now is actually a previous dislocation. That's the biggest risk factor for another shoulder dislocation. And I often find myself having to adjust the spine, right, to allow those muscles controlling the shoulder to be a lot more, I guess, has more integrity, right, for those muscles to actually get more juice, and then get them to go for a rehab. and that's when a physiotherapist comes in. So Jonathan, just to answer that question in brevity, that's just the way that I would go. So TCM, unfortunately, in my reading and studying, TCM actually focuses on decreasing chronic pain, but it doesn't necessarily turn on the muscles like it would with a chiro adjustment and rehab. Right. So like I was saying earlier on with the neuroscience, like your brain likes diversity, and the diversity of movements with rehab and coupled with chiro adjustment actually does allow the brain to turn on certain muscles again that has been switched off for so long. So unfortunately, TCM is great for chronic pain, but just not in the case of a shoulder dislocation. I love what you said, Keith, about motion is lotion, 100%. Motion is lotion. Oh, that's you, Hannah? Awesome. Right. Yes, Janelle will just live be posted 100%. Janelle did also say, can I know what's the difference between sports therapy and physiotherapy? Okay, that's this question for you, Hannah, and then after that we'll wrap it up because we are over time. But this is so much more. So yeah, we'll just make this the last question, okay?
Okay, quick one. Those that have studied sports therapy or sports science or sports rehabilitation in university, they're a lot more focused towards performance and the movements that are involved in specific sports-related things like baseball throwing, football, swimming. Those kind of movements they're a lot more familiar with. They know how to design programs that are able to address what the professional athlete or high-performance player needs. In terms of physiotherapy, we don't touch as much. We do have a basic understanding, but we don't touch it as much. We're more focused on rehabilitation after an injury happens. So the way that they work together might be, let's say after a footballer sprains his ankle, he might see a physiotherapist to reduce the pain, swelling, inflammation, activate back the muscles, stabilize the ankle. Once everything is stabilized, they'll be passed on to the sports rehabilitation person to further fast track his performance to get him back on the field. Some physiotherapists have sports background training as well. They might do a further education on it, or they might just be personally involved. Those that will be able to help in kind of like a dual role. For me, if I don't have that, I will pass on to either a personal trainer or those with a sports rehab background.
Yeah, okay, right. So in Spinefit Chiro Physio, you guys actually have like a referral form that you guys will send to patients stuff. That's amazing. Wow. Yeah, that's something that I definitely want to incorporate in my practice because like I'm only 6 months in, but that's definitely something that I want to start to do as well.
But I think it's also important to formulate some like getting to know these individuals first. Like for us, we also get to know individuals first, then we know how they think, because you want to make sure that you are actually referring people that are like-minded. Yes. Yeah. Because the patients that come to see you, they put their trust in you, right? And then you refer out to somebody who, because you just see that, oh, they've got the credentials for it, but not necessarily they might have that same approach. Yeah. And then the patient goes there and then they're like, oh my gosh, I really hated my time there, and then it was from you. Now you've broken that trust. Yes.
Yeah, that is so true.
It's also it's also like Keith said, if you have that trust between the two, the person you're referring on, it's easier for your patient as well, because I've had a patient, not here, back in Australia, that I referred to like just a GP to get like a blood test or something, because I noticed something in the history. And when she went to the GP was like, "You're seeing a chiro. Why are you seeing a chiro?" Just laughed the idea off of seeing a chiro, and then the patient never came back to me.
Wow.
So it's like, that's why it's really important that when you're referring patients out, you have to make sure that relationship is strong first. The trust between you and that person.
Yeah. That's so true. Actually, just kind of wrap it up, and back to the first point that I was sharing on, with regarding the three forms of collaboration, right? Like the collaboration between you and the patient, which is what we're after, and the collaboration between you and other professions, which is interprofession, and is collaboration within your profession itself. So like whatever we talked about, guys, like it's been so enriching to learn, but it really boils down to these three things. Like when we collaborate with each other, we are actually collaborating with the intention of getting the patient better. So with that, I want to wrap up this entire amazing IG Live. Definitely went over time, but I felt there was just so much gold, and I think that, honestly, guys, you guys have so much experience under your belt, like 6-7 years of running this clinic, Keith and Dr. Chandra and Hannah. Like, you guys have a lot more gold to give. So I just want to say thank you so much for spending time to pour into us. If you guys can agree on one sentence, right, to hit us home with, like the last sentence to hit the Singapore crowd with, like what would you say it would be? Like what's the last farewell? I mean, not farewell for good, but like what's the goodbye statement? You guys gotta agree on one, because you guys are so collaborated. You guys gotta agree on one statement.
Yeah.
Community, not competition.
Correct.
It's on our core value statement.
Oh wow, I love that. Collaboration, community, not competition. Wow,
Yeah.
I love that. Yeah, which is for me personally, it's collaboration, not competition. So collaboration and community.
Yeah.
That's amazing. Yeah. So thanks everyone for watching. This definitely wouldn't be the last of collaboration. There's definitely going to be another episode where we collaborate with someone else. I myself, Dr. Ben, will collaborate with someone else. But like what these guys are mentioning, that we want to start to find people who are like-minded, who are trustworthy, and I believe there's so many more practitioners out there who are just in it for the patient. They have patient at the center of their interest. So with that, I just want to thank everyone, guys. This video will be posted on my page. I'm not sure if I can send it to the Spinefit Chiro Physio, but if I can, I will send it to them so that they can post it on their page as well. But if you guys have any questions, feel free to ask. I have this hashtag that I've recently been focusing on. It's called Ask Dr. Ben. There's no question too dumb. There's no query too stupid to ask. So please put forth the questions, because there are people out there who are dying, I would say, dying to answer your questions. So with that, I thank you guys. Thank everyone for joining. Apologies for that technical blurb, but
Sorry.
no, it was still gold overall.
Yeah.
So thank you all for coming on.
Thanks guys for listening.
Thank you.
Thank you so much.
All right. Hey, let's just take a quick selfie if that's something that we can do.
Yes.
All right. 1, 2, 3. Yeah. All right, guys. Thank you so much.
Thank you.
See you all soon.
Bye.
Bye.
All right. Bye-bye. Take care.